Welcome to 50 Pharmacology SATA questions that feel impossible. These questions are designed to challenge your clinical judgment with medication interactions, adverse effects, contraindications, toxicity, antidotes, and priority nursing actions. Read every option carefully, because more than one answer may be correct, and the most tempting option may be the trap. Question 1. A client with bipolar disorder has been taking lithium carbonate for several months. During a follow-up visit, the client reports experiencing several new symptoms after developing gastroenteritis 3 days ago. The client states, "I have barely been eating or drinking because I keep vomiting." The nurse notes a coarse hand tremor, unsteady gait, slurred speech, and increasing lethargy. The most recent lithium level is 2.1 milliequivalent/L. Which nursing actions are appropriate? Select all that apply. A. Hold the next dose of lithium and notify the healthcare provider. B. Encourage the client to increase sodium restriction to prevent fluid retention. C. Assess the client for worsening neurologic manifestations. D. Administer the next scheduled dose with food to reduce gastrointestinal irritation. E. Anticipate interventions to promote lithium elimination as prescribed. F. Recognize that dehydration can increase the risk of lithium toxicity. G. Encourage the client to rapidly drink several liters of water without further assessment. Answer: A, C, E, F. Rationale: a lithium level of 2.1 milliequivalent/L with coarse tremor, ataxia, slurred speech, and lethargy indicates significant lithium toxicity. The nurse should withhold lithium, notify the provider, monitor neurologic status, and anticipate treatment aimed at reducing lithium concentration. Vomiting and poor fluid intake cause dehydration, which can increase lithium concentration. Sodium depletion can also increase lithium reabsorption. Question 2. A client with major depressive disorder is prescribed phenelzyme, a monoamine oxidase inhibitor, MAOI. During medication teaching, the client asks which foods can safely be consumed. The nurse wants to identify foods that could place the client at risk for a potentially life-threatening hypertensive reaction. Which client statements indicate a need for additional teaching? Select all that apply. A. I can eat aged cheddar cheese occasionally. B. Fresh chicken that has been properly refrigerated is generally acceptable. C. I can drink tap beer as long as I do not drink too much. D. I should avoid fermented soybean products such as certain types of miso. E. I can eat smoked or cured meats whenever I want. F. Fresh fruits such as apples and oranges are generally safe. G. I should check with my healthcare provider before taking over-the-counter cold medications. Answer: A, C, E. Rationale: MAOIs inhibit the metabolism of tyramine, which can produce a dangerous hypertensive reaction. High tyramine foods include aged cheeses, fermented products, and certain cured/smoked meats. Tap beer may also contain significant tyramine. Fresh meats and most fresh fruits are generally safe. Many sympathomimetic-containing OTC medications can also interact dangerously with MAOIs. Question 3. A client with type 1 diabetes mellitus is admitted with diabetic ketoacidosis, DKA. The provider prescribes an 4 regular insulin infusion. Before initiating treatment, the nurse reviews the client's laboratory results and notes a serum potassium level of 2.8 milliequivalent/L. Which nursing actions are appropriate? Select all that apply. A. Question the immediate initiation of the insulin infusion. B. Anticipate potassium replacement as prescribed. C. Recognize that insulin can shift potassium from the blood into cells. D. Administer 4 potassium rapidly through a peripheral line to correct the level immediately. E. Place the client on appropriate cardiac monitoring. F. Recognize that the serum potassium may fall further after insulin therapy begins. G. Give an additional dose of 4 regular insulin to accelerate correction of the acidosis. Answer: A, B, C, E, F. Rationale: although potassium is often elevated or normal initially in DKA, total body potassium is depleted. When the serum potassium is already below 3.3 milliequivalent/L, insulin is generally held temporarily while potassium is replaced because insulin can cause an additional intracellular potassium shift and precipitate life-threatening hypokalemia and dysrhythmias. Cardiac monitoring is appropriate. For potassium, must never be administered rapidly as an uncontrolled bolus. Question 4. A hospitalized client receiving 4 heparin for an acute pulmonary embolism suddenly develops a platelet count decrease from 238,000/mm superscript 3 to 96,000/mm superscript 3 on day 7 of therapy. The client also reports new pain and coolness in the right foot. The nurse suspects heparin-induced thrombocytopenia, HIT. Which interventions should the nurse anticipate? Select all that apply. A. Discontinue heparin as prescribed. B. Notify the healthcare provider promptly. C. Expect initiation of a non-heparin anticoagulant. D. Administer platelet transfusions routinely to correct the thrombocytopenia. E. Recognize that HIT is associated with thrombosis despite the low platelet count. F. Begin warfarin immediately as the sole replacement anticoagulant. G. Avoid heparin-containing products unless specifically determined to be safe. Answer: A, B, C, E, G. Rationale: HIT is an immune-mediated reaction that causes platelet activation and a high risk of thrombosis, not simply bleeding. Heparin must be stopped, including other potential heparin exposures, and a non-heparin anticoagulant is generally initiated. Routine platelet transfusion is not indicated unless there is significant bleeding or another specific indication. Warfarin should not be initiated alone during acute HIT because it can worsen the thrombotic process. Question 5. A client with heart failure is prescribed digoxin. Before administering the medication, the nurse reviews the client's assessment findings and laboratory results. The client reports nausea and decreased appetite and states, "My vision looks strange today." The apical pulse is 52 per minute, and the serum potassium level is 3.0 milliequivalent/L. Which findings or actions should concern the nurse? Select all that apply. A. Apical pulse of 52 per minute. B. Serum potassium of 3.0 milliequivalent/L. C. New visual disturbances. D. Nausea and anorexia. E. Administering digoxin without further assessment. F. Anticipating an ECG evaluation. G. Recognizing that hypokalemia can increase the risk of digoxin toxicity. Answer: A, B, C, D, F, G. Rationale: bradycardia, gastrointestinal symptoms, visual disturbances, and hypokalemia are important findings associated with digoxin toxicity. The nurse should withhold the medication according to appropriate parameters and notify the provider. ECG assessment may be necessary because toxicity can produce potentially serious dysrhythmias. Hypokalemia increases myocardial sensitivity to digoxin. Question 6. A client with severe asthma is prescribed theophylline. The client reports drinking several energy drinks daily and recently began taking an OTC medication for a respiratory infection. During assessment, the nurse notes vomiting, restlessness, tremors, and a heart rate of 124 per minute. Which nursing actions are appropriate? Select all that apply. A. Assess for manifestations of theophylline toxicity. B. Review the client's caffeine intake. C. Obtain the prescribed serum theophylline concentration. D. Encourage additional caffeine to counteract fatigue. E. Monitor the client for dysrhythmias. F. Review all prescription and OTC medications for interactions. G. Assume the symptoms are expected effects of effective bronchodilation. Answer: A, B, C, E, F. Rationale: theophylline has a narrow therapeutic index. Toxicity may produce nausea, vomiting, tremor, restlessness, tachycardia, and potentially life-threatening dysrhythmias or seizures. Caffeine can intensify adverse effects because it has similar stimulant properties. Drug interactions can significantly alter theophylline concentration. Question 7. A client receiving vancomycin for a serious MRSA infection develops flushing of the face, neck, and upper torso during the infusion. The client reports generalized itching and a feeling of warmth. Blood pressure is currently stable, and there is no wheezing or airway swelling. Which nursing actions are appropriate? Select all that apply. A. Stop or slow the infusion according to protocol and notify the provider. B. Assess the client for hypotension and airway compromise. C. Recognize that rapid vancomycin infusion can cause an infusion-related reaction. D. Immediately label the client as having a permanent Ig-mediated vancomycin allergy. E. Anticipate that the medication may need to be administered more slowly in the future. F. Continue the infusion at the same rate because blood pressure is stable. G. Monitor the client closely for progression to a more severe reaction. Answer: A, B, C, E, G. Rationale: flushing, pruritus, and warmth during rapid 4-vancomycin administration are characteristic of vancomycin infusion reaction, Redman syndrome, related to histamine release. The infusion should be stopped or slowed according to protocol, and the client should be assessed for hypotension or airway compromise. Future doses may require a slower infusion and, when prescribed, pre-medication. Question 8. A client with hypertension is prescribed lisinopril. 2 weeks later, the client reports a persistent dry cough. During today's visit, the client develops sudden swelling of the lips and tongue and has difficulty speaking clearly. The nurse recognizes a potentially serious adverse effect. Which nursing actions are appropriate? Select all that apply. A. Discontinue the medication and notify the provider immediately. B. Assess airway patency and respiratory status. C. Recognize the findings as possible ACE inhibitor-associated angioedema. D. Tell the client that the swelling is an expected minor adverse effect. E. Prepare for emergency airway management if symptoms progress. F. Encourage the client to take another dose to determine whether symptoms resolve. G. Recognize that angioedema can occur even after the client has taken the medication previously without difficulty. Answer: A, B, C, E, G. Rationale: lip and tongue swelling with speech difficulty suggests angioedema, which can rapidly compromise the airway. ACE inhibitors can cause angioedema even after previous uneventful use. The medication should be discontinued and emergency assessment initiated. Question 9. A client receiving warfarin for atrial fibrillation is preparing for discharge. The nurse evaluates the client's understanding of medication and dietary management. Which statements by the client demonstrate correct understanding? Select all that apply. A. I should report unusual bleeding or black, tarry stools. B. I should keep my intake of vitamin K containing foods relatively consistent. C. I can take aspirin whenever I have a headache without asking anyone. D. I should have my INR monitored as instructed. E. If I miss a dose, I should double the next dose automatically. F. I should tell healthcare providers and dentists that I take warfarin. G. I should check with my healthcare provider before starting new OTC medications or supplements. Answer: A, B, D, F, G. Rationale: warfarin increases bleeding risk and requires INR monitoring. Clients should maintain a consistent vitamin K intake rather than eliminating vitamin K foods completely. Aspirin and many OTC medications or supplements can increase bleeding risk. Missed doses should be managed according to specific provider instructions rather than automatically doubling the next dose. Question 10. A client receiving gentamicin for a severe gram-negative infection has been receiving therapy for several days. The nurse notes that the client's serum creatinine has increased from 0.9 milligrams per deciliter to 1.8 milligrams per deciliter. The client reports decreased urine output and new difficulty hearing high-pitched sounds. Which nursing actions are appropriate? Select all that apply. A. Notify the healthcare provider about the change in renal function. B. Assess the client's urine output closely. C. Recognize that gentamicin can cause nephrotoxicity. D. Recognize that gentamicin can cause ototoxicity. E. Anticipate review of the gentamicin serum concentration, if ordered. F. Administer the next dose early to maintain therapeutic drug levels. G. Monitor renal function during therapy. Answer: A, B, C, D, E, G. Rationale: gentamicin is an aminoglycoside associated with nephrotoxicity and ototoxicity. Rising creatinine, decreased urine output, and hearing changes are concerning. Renal function and, when indicated, serum drug concentrations must be monitored carefully. The next dose should not simply be administered early in response to these findings. Question 11. A client with schizophrenia has been receiving clozapine for treatment-resistant symptoms. During a follow-up assessment, The client reports a sore throat, fever, and profound fatigue. Laboratory results show an absolute neutrophil count, ANC, of 850/mm superscript 3. The client asks whether the medication should simply be continued because the psychiatric symptoms have improved significantly. Which nursing actions or interpretations are appropriate? Select all that apply. A. Recognize the client's symptoms as potentially indicating neutropenia. B. Notify the healthcare provider promptly about the ANC result and symptoms. C. Anticipate that clozapine may need to be withheld according to the current monitoring protocol. D. Encourage the client to attend crowded public events to maintain social functioning. E. Monitor closely for signs of infection. F. Recognize that clozapine can cause potentially severe neutropenia or agranulocytosis. G. Reassure the client that fever is an expected harmless effect of clozapine. Answer: A, B, C, E, F. Rationale: clozapine can cause severe neutropenia/agranulocytosis, placing the client at serious risk for infection. Fever and sore throat in a client with a markedly reduced ANC require prompt evaluation and management according to the medication's monitoring requirements. The medication may need to be withheld depending on the ANC and current protocol. Question 12. A client with Parkinson's disease is prescribed levodopa/carbidopa. After several months of treatment, the client reports that the medication no longer seems to control symptoms consistently. The client also reports involuntary writhing movements and episodes in which mobility suddenly improves and then deteriorates before the next scheduled dose. Which findings or teaching points should the nurse recognize as clinically significant? Select all that apply. A. Dyskinesias may occur with long-term dopaminergic therapy. B. On-off fluctuations may occur with levodopa therapy. C. The client should stop the medication abruptly when symptoms improve. D. Orthostatic hypotension can occur with dopaminergic therapy. E. The nurse should assess the client for falls and safety risks. F. Taking extra doses independently is an appropriate response to wearing off symptoms. G. Medication timing should be maintained according to the prescribed schedule. Answer: A, B, D, E, G. Rationale: long-term levodopa therapy can produce dyskinesias and motor fluctuations, including on-off phenomena. Orthostatic hypotension can increase fall risk. The client should follow the prescribed dosing schedule and should not independently alter or abruptly discontinue therapy. Question 13. A client with chronic obstructive pulmonary disease, COPD, is prescribed prednisone for an acute exacerbation. The client has diabetes mellitus and asks why blood glucose is being monitored more frequently while taking the corticosteroid. Which statements by the nurse are appropriate? Select all that apply. A. Corticosteroids can increase blood glucose levels. B. Long-term corticosteroid therapy can suppress adrenal function. C. The medication should be stopped abruptly once breathing improves. D. Corticosteroids can increase susceptibility to infection. E. Long-term therapy can contribute to osteoporosis. F. The client should report signs of infection. G. Blood glucose monitoring may need to be increased during therapy. Answer: A, B, D, E, F, G. Rationale: corticosteroids can cause hyperglycemia, immunosuppression, osteoporosis, and adrenal suppression, particularly with prolonged therapy. Abrupt discontinuation after prolonged treatment can precipitate adrenal insufficiency. Tapering may be required. Question 14. A client with rheumatoid arthritis has been prescribed methotrexate. At a follow-up appointment, the client reports mouth sores and unusual fatigue. Laboratory results reveal decreased white blood cells and elevated liver enzymes. The client tells the nurse, "I take my methotrexate every day because I thought it was like my other medications." Which nursing interventions or teaching points are appropriate? Select all that apply. A. Notify the healthcare provider about the laboratory abnormalities and symptoms. B. Recognize that methotrexate can cause bone marrow suppression. C. Recognize that methotrexate can cause hepatotoxicity. D. Reinforce that methotrexate for rheumatoid arthritis is commonly administered on a weekly schedule, not daily. E. Encourage the client to double the next dose if one dose was missed. F. Monitor for signs of infection and bleeding. G. Reinforce the need for regular laboratory monitoring. Answer: A, B, C, D, F, G. Rationale: methotrexate can cause bone marrow suppression and hepatotoxicity. Oral ulcers can also occur. A major medication safety danger is accidental daily administration when the prescribed regimen is weekly, which can result in fatal toxicity. CBC and liver function monitoring are essential. Question 15. A client with major depressive disorder has been taking sertraline. The client recently began using another serotonergic medication prescribed by a different provider. The nurse now observes agitation, diaphoresis, diarrhea, hyperreflexia, tremor, and a temperature of 39.2 degrees Celsius, 102.6 degrees Fahrenheit. Which nursing actions or interpretations are appropriate? Select all that apply. A. Suspect serotonin syndrome. B. Notify the healthcare provider immediately. C. Assess for worsening neuromuscular abnormalities. D. Recognize hyperreflexia and clonus as important findings. E. Administer additional serotonergic medication to stabilize mood. F. Review all medications and supplements for serotonergic interactions. G. Recognize that severe cases can progress to seizures, hyperthermia, and cardiovascular instability. Answer: A, B, C, D, F, G. Rationale: serotonin syndrome can occur when serotonergic medications interact or accumulate. Findings include agitation, diaphoresis, diarrhea, hyperthermia, tremor, hyperreflexia, and clonus. Severe toxicity can progress to seizures and significant autonomic instability. Question 16. A client receiving morphine after abdominal surgery becomes increasingly difficult to arouse. The respiratory rate is 7 per minute, oxygen saturation is 86%, and the client has pinpoint pupils. The nurse prepares for emergency intervention. Which actions are appropriate? Select all that apply. A. Assess and support the client's airway and breathing. B. Administer naloxone as prescribed. C. Monitor respiratory status continuously. D. Recognize the findings as consistent with opioid-induced respiratory depression. E. Administer another dose of morphine to prevent withdrawal symptoms. F. Prepare for repeated naloxone administration if respiratory depression recurs. G. Continue routine post-operative monitoring without intervention because pinpoint pupils are expected with opioids. Answer: A, B, C, D, F. Rationale: severe sedation, respiratory depression, hypoxemia, and pinpoint pupils strongly suggest opioid toxicity. Airway and ventilation take priority, and naloxone reverses opioid effects. Because naloxone may have a shorter duration than some opioids, repeated dosing and continued monitoring may be necessary. Question 17. A client with heart failure is prescribed furosemide. After several days of therapy, the client reports muscle weakness and leg cramps. Laboratory results show potassium 2.9 milliequivalent/L and magnesium 1.4 milligrams per deciliter. The client has also experienced a significant increase in urine output. Which nursing actions or interpretations are appropriate? Select all that apply. A. Recognize that furosemide can cause potassium loss. B. Recognize that furosemide can contribute to magnesium loss. C. Monitor cardiac rhythm because significant electrolyte abnormalities can cause dysrhythmias. D. Anticipate electrolyte replacement as prescribed. E. Encourage the client to restrict all potassium-containing foods permanently. F. Monitor renal function and electrolyte levels. G. Recognize that the client's muscle weakness may be related to electrolyte depletion. Answer: A, B, C, D, F, G. Rationale: loop diuretics such as furosemide can cause hypokalemia and hypomagnesemia, producing weakness, cramps, and potentially dangerous dysrhythmias. Electrolytes, renal function, intake/output, and cardiac rhythm should be monitored. Question 18. A client taking amiodarone for recurrent ventricular dysrhythmias returns for follow-up. The client reports increasing shortness of breath and a persistent non-productive cough. The nurse also notes that the client has developed new visual disturbances and has a mildly elevated TSH. Which assessments or actions are appropriate? Select all that apply. A. Assess for possible pulmonary toxicity. B. Recognize that amiodarone can affect thyroid function. C. Report new respiratory symptoms promptly. D. Recognize that visual changes can occur with amiodarone therapy. E. Assume the cough is harmless because amiodarone treats cardiac disease. F. Anticipate thyroid function monitoring. G. Recognize that amiodarone can produce serious extracardiac adverse effects. Answer: A, B, C, D, F, G. Rationale: amiodarone has multiple important toxicities, including pulmonary toxicity, thyroid dysfunction, hepatic injury, ocular effects, and cardiac effects. New cough and dyspnea require prompt evaluation for pulmonary toxicity. Thyroid function and other organ systems require monitoring during therapy. Question 19. A client receiving vancomycin for endocarditis has a trough concentration above the desired therapeutic range and a rising serum creatinine. The client has also developed decreased urine output. Which nursing actions are appropriate? Select all that apply. A. Notify the healthcare provider about the laboratory changes. B. Recognize that vancomycin can cause nephrotoxicity. C. Review the dosing interval and renal function. D. Anticipate adjustment of the vancomycin regimen. E. Administer the next dose early because the infection is severe. F. Monitor urine output. G. Review other medications that may increase nephrotoxic risk. Answer: A, B, C, D, F, G. Rationale: elevated vancomycin concentrations combined with rising creatinine and reduced urine output suggest increased risk for nephrotoxicity. Dosing must account for renal function and drug concentration. Other nephrotoxic medications can further increase the risk. Question 20. A client with a mechanical heart valve is receiving anticoagulation therapy. The client is prescribed a new antibiotic for an infection. 2 days later, the client reports bleeding gums and dark urine. Laboratory results show an INR significantly above the therapeutic range. Which nursing actions or interpretations are appropriate? Select all that apply. A. Assess the client for additional signs of bleeding. B. Notify the healthcare provider promptly. C. Review the new antibiotic for a potential interaction with the anticoagulant. D. Recognize that some antibiotics can increase anticoagulant effects. E. Tell the client to take an extra anticoagulant dose to compensate for the infection. F. Anticipate that the anticoagulant regimen may require adjustment. G. Reinforce the importance of reporting unusual bleeding. Answer: A, B, C, D, F, G. Rationale: an excessively elevated INR with active bleeding is a significant medication safety concern. Some antibiotics can increase anticoagulant effects, raising bleeding risk. The nurse should assess bleeding, notify the provider, review drug interactions, and anticipate appropriate modification of therapy. Question 21. A client with type 2 diabetes mellitus is prescribed metformin. The client is admitted with severe vomiting, diarrhea, dehydration, and acute kidney injury. The serum creatinine is significantly elevated, and the client is scheduled for a contrast-enhanced CT scan. Which nursing actions or interpretations are appropriate? Select all that apply. A. Notify the healthcare provider about the acute kidney injury. B. Recognize that severe renal impairment increases the risk associated with metformin therapy. C. Anticipate that metformin may need to be temporarily withheld. D. Recognize that iodinated contrast procedures may require special management of metformin. E. Encourage the client to continue taking metformin despite persistent dehydration. F. Monitor renal function closely. G. Recognize that metformin-associated lactic acidosis is rare but potentially life-threatening. Answer: A, B, C, D, F, G. Rationale: metformin is associated with a rare but serious risk of lactic acidosis, particularly when significant renal dysfunction, hypoperfusion, or other high-risk conditions are present. Acute kidney injury and dehydration require prompt evaluation. Metformin management around iodinated contrast depends on renal function and current guidelines. Question 22. A client with atrial fibrillation is prescribed apixaban. During a medication reconciliation interview, the client reports taking ibuprofen several times daily for chronic knee pain and recently started an herbal supplement without informing the healthcare provider. The client has also noticed several unexplained bruises. Which nursing actions are appropriate? Select all that apply. A. Assess for additional manifestations of bleeding. B. Review all prescription, OTC, and herbal medications. C. Recognize that NSAIDs can increase bleeding risk when combined with anticoagulants. D. Notify the healthcare provider about the unexplained bruising. E. Tell the client to discontinue apixaban permanently without consulting the provider. F. Reinforce that new medications and supplements should be reviewed before use. G. Monitor for occult or overt bleeding as clinically indicated. Answer: A, B, C, D, F, G. Rationale: apixaban increases bleeding risk, which may be amplified by NSAIDs and certain supplements. Unexplained bruising requires assessment and provider notification. Anticoagulants should not be stopped independently unless specifically directed. Question 23. A client with an acute myocardial infarction receives alteplase. 30 minutes later, the nurse notes new severe headache, vomiting, confusion, and a sudden decrease in level of consciousness. Which actions should the nurse take? Select all that apply. A. Stop the alteplase infusion if it is still being administered. B. Notify the healthcare provider/emergency response team immediately. C. Assess neurologic status frequently. D. Recognize possible intracranial hemorrhage. E. Administer aspirin immediately to improve the thrombolytic effect. F. Prepare for diagnostic evaluation and management of possible bleeding. G. Assess for other manifestations of serious bleeding. Answer: A, B, C, D, F, G. Rationale: sudden severe headache, vomiting, confusion, and decreased consciousness after thrombolytic therapy are highly concerning for intracranial hemorrhage, a potentially fatal complication. Thrombolytic therapy should be stopped when appropriate, emergency evaluation initiated, and bleeding assessed. Question 24. A client with hypothyroidism has been taking levothyroxine. The client reports that the medication isn't working anymore and states that it is taken every morning with breakfast along with calcium carbonate and an iron supplement. The TSH remains elevated. Which teaching points should the nurse provide? Select all that apply. A. Take levothyroxine consistently on an empty stomach as directed. B. Separate levothyroxine from calcium-containing products. C. Separate levothyroxine from iron supplements. D. Take levothyroxine only when symptoms of hypothyroidism occur. E. Maintain a consistent administration routine. F. Recognize that calcium and iron can reduce levothyroxine absorption. G. Expect the healthcare provider to monitor thyroid function laboratory results. Answer: A, B, C, E, F, G. Rationale: calcium and iron can decrease levothyroxine absorption, resulting in inadequate thyroid hormone replacement. Levothyroxine is generally taken consistently on an empty stomach, with appropriate separation from interfering medications and supplements. Question 25. A client with chronic adrenal insufficiency takes hydrocortisone. The client develops vomiting and diarrhea and is unable to keep oral medications down. The client becomes profoundly weak, hypotensive, and confused. Which nursing actions or interpretations are appropriate? Select all that apply. A. Recognize the possibility of adrenal crisis. B. Notify the healthcare provider/emergency response team immediately. C. Anticipate parenteral corticosteroid therapy. D. Monitor blood pressure and hemodynamic status closely. E. Encourage the client to permanently discontinue corticosteroid therapy. F. Anticipate fluid and electrolyte management. G. Recognize that acute illness can increase corticosteroid requirements. Answer: A, B, C, D, F, G. Rationale: a client with adrenal insufficiency who cannot absorb corticosteroids and develops hypotension, weakness, and altered mental status may be experiencing adrenal crisis. Emergency treatment includes appropriate parenteral corticosteroid replacement and supportive fluid/electrolyte management. Question 26. A client is prescribed propranolol for hypertension and migraine prevention. The client also has asthma and uses an albuterol inhaler as needed. During medication teaching, the nurse evaluates the client's understanding of potential effects. Which statements or findings require attention? Select all that apply. A. I should report new wheezing or difficulty breathing. B. This medication may slow my heart rate. C. I can stop propranolol suddenly whenever my blood pressure improves. D. A beta blocker may interfere with the effects of albuterol. E. I should monitor for dizziness or symptoms of hypotension. F. I should check with my provider before making major changes to the medication. G. If I have severe bronchospasm, I should simply take an extra dose of propranolol. Answer: A, B, D, E, F. Rationale: non-selective beta blockers such as propranolol can cause bronchoconstriction and may antagonize beta-2 agonists such as albuterol. Bradycardia and hypotension can also occur. Abrupt withdrawal can cause rebound cardiovascular effects, so the medication should generally be tapered under medical supervision. Question 27. A client receiving carbamazepine for seizure control reports fever, sore throat, unusual bruising, and a new widespread skin rash. Laboratory results show a declining white blood cell count. Which nursing actions or interpretations are appropriate? Select all that apply. A. Notify the healthcare provider promptly. B. Recognize that carbamazepine can cause serious blood dyscrasias. C. Assess the rash for progression and mucosal involvement. D. Recognize that a severe skin reaction may require immediate intervention. E. Reassure the client that all rashes caused by anticonvulsants are harmless. F. Monitor CBC results as prescribed. G. Assess for signs of infection and bleeding. Answer: A, B, C, D, F, G. Rationale: carbamazepine can cause bone marrow suppression, including leukopenia and, rarely, agranulocytosis. Serious dermatologic reactions can also occur. Fever, sore throat, bruising, and rash require prompt evaluation rather than reassurance. Question 28. A client with a history of peptic ulcer disease is prescribed prednisone for an autoimmune disorder. The client also takes aspirin daily. During follow-up, the client reports epigastric pain and black, tarry stools. Which nursing actions are appropriate? Select all that apply. A. Assess for gastrointestinal bleeding. B. Notify the healthcare provider promptly. C. Recognize that corticosteroids can increase gastrointestinal risk, particularly with other ulcerogenic medications. D. Recognize aspirin as another medication that can increase GI bleeding risk. E. Encourage the client to take additional aspirin for pain relief. F. Monitor hemoglobin and hematocrit as prescribed. G. Assess for signs of hemodynamic instability. Answer: A, B, C, D, F, G. Rationale: melena and epigastric pain suggest upper GI bleeding. Aspirin increases GI bleeding risk, and concurrent corticosteroid therapy can further increase gastrointestinal complications. The nurse should assess bleeding severity and hemodynamic status and notify the provider. Question 29. A client receiving 4-potassium chloride for severe hypokalemia asks why the medication is being administered through an infusion pump. The client states, "If my potassium is dangerously low, shouldn't it be pushed quickly?" Which nursing responses or actions are correct? Select all that apply. A. Explain that 4-potassium must be administered at a controlled rate. B. Recognize that rapid 4-potassium administration can cause fatal cardiac dysrhythmias. C. Use an infusion pump according to institutional protocol. D. Monitor the cardiac rhythm when indicated for significant potassium replacement. E. Administer concentrated potassium chloride by 4-push during severe hypokalemia. F. Monitor serum potassium levels during replacement. G. Assess the foresight for complications during infusion. Answer: A, B, C, D, F, G. Rationale: for potassium chloride must never be administered by 4-push. Rapid administration can cause severe cardiac conduction abnormalities, ventricular dysrhythmias, cardiac arrest, and death. Controlled infusion, appropriate dilution, monitoring, and reassessment are essential. Question 30. A client with rheumatoid arthritis is receiving hydroxychloroquine for long-term disease management. During medication teaching, the nurse discusses adverse effects requiring ongoing surveillance. Which teaching points are appropriate? Select all that apply. A. Report new visual changes promptly. B. Understand that long-term therapy can cause retinal toxicity. C. Attend recommended ophthalmologic examinations. D. Report unexplained muscle weakness if it develops. E. Stop all eye examinations because the medication does not affect vision. F. Take the medication exactly as prescribed and attend follow-up appointments. G. Recognize that serious toxicity can occur even though the medication may be well tolerated initially. Answer: A, B, C, D, F, G. Rationale: hydroxychloroquine can cause retinal toxicity, particularly with long-term exposure and certain risk factors, making appropriate ophthalmologic screening important. Neuromuscular adverse effects can also occur. New visual symptoms should never be ignored. Question 31. A client with schizophrenia has been taking haloperidol for several weeks. The nurse notices that the client has developed severe muscle rigidity, a temperature of 40 degrees Celsius, 104 degrees Fahrenheit, diaphoresis, altered mental status, and labored breathing. The client's creatine kinase level is markedly elevated. Which nursing actions or interpretations are appropriate? Select all that apply. A. Suspect neuroleptic malignant syndrome, NMS. B. Notify the healthcare provider/emergency response team immediately. C. Anticipate discontinuation of the antipsychotic medication. D. Monitor the client's airway, respiratory status, and cardiovascular status. E. Encourage the client to continue haloperidol to prevent psychotic relapse. F. Anticipate aggressive supportive management and treatment as prescribed. G. Recognize that severe muscle rigidity and hyperthermia are important findings. Answer: A, B, C, D, F, G. Rationale: NMS is a life-threatening reaction associated with dopamine-blocking medications. Classic findings include severe rigidity, hyperthermia, autonomic instability, altered mental status, and elevated CK. The offending medication must be stopped and emergency supportive management initiated. Question 32. A client taking sertraline for depression reports that the medication has improved mood but states, "I stopped taking it 3 days ago because I felt completely better." The client now reports dizziness, nausea, irritability, insomnia, and unusual electric shock sensations. Which nursing responses are appropriate? Select all that apply. A. Recognize the possibility of antidepressant discontinuation symptoms. B. Explain that abrupt discontinuation can produce unpleasant symptoms. C. Reinforce that antidepressants should generally be tapered under provider guidance when discontinuation is appropriate. D. Tell the client to double the next dose to compensate for missed doses. E. Assess for suicidal thoughts or worsening depression. F. Encourage the client to restart or change the medication only according to the prescriber's instructions. G. Explain that feeling better means the medication should always be stopped immediately. Answer: A, B, C, E, F. Rationale: abrupt discontinuation of some antidepressants, including SSRIs, can produce discontinuation symptoms such as dizziness, nausea, irritability, sleep disturbance, and sensory disturbances. The client should not independently stop or alter therapy. Because antidepressant changes can coincide with worsening mood, suicide risk should also be assessed. Question 33. A client with hypertension is prescribed spironolactone. The client has chronic kidney disease and is also taking an ACE inhibitor. During a follow-up visit, the serum potassium level is 6.1 milliequivalent/L. Which nursing actions or interpretations are appropriate? Select all that apply. A. Recognize that the client is at risk for hyperkalemia. B. Notify the healthcare provider promptly. C. Review the client's medications for additional potassium-raising effects. D. Assess the client for cardiac dysrhythmias and obtain ECG monitoring as indicated. E. Encourage the client to use potassium-based salt substitutes. F. Recognize that renal impairment increases the risk of spironolactone-associated hyperkalemia. G. Anticipate holding potassium-increasing medications as prescribed. Answer: A, B, C, D, F, G. Rationale: spironolactone is a potassium-sparing diuretic. Combining it with an ACE inhibitor and chronic kidney disease substantially increases hyperkalemia risk. A potassium of 6.1 milliequivalent/L is clinically significant and may produce life-threatening cardiac conduction abnormalities. Question 34. A client receiving phenytoin for seizure prevention is preparing for discharge. The client asks about medication administration and oral care. The nurse reviews the client's understanding of long-term therapy. Which teaching points should the nurse include? Select all that apply. A. Maintain good oral hygiene and regular dental care. B. Report excessive gum enlargement or bleeding. C. Avoid abruptly stopping phenytoin without medical guidance. D. Understand that phenytoin can cause gingival hyperplasia. E. Recognize that some formulations and medications can alter phenytoin levels. F. Double the next dose whenever a dose is missed. G. Understand that serum drug level monitoring may be necessary. Answer: A, B, C, D, E, G. Rationale: phenytoin can cause gingival hyperplasia, making meticulous oral hygiene important. It has numerous drug interactions and a relatively narrow therapeutic range, so serum levels may be monitored. Abrupt discontinuation can precipitate seizures. Question 35. A client receiving 4-magnesium sulfate for severe preeclampsia is being monitored in the labor unit. The nurse notes a respiratory rate of 9 per minute, absent patellar reflexes, increasing lethargy, and urine output of 20 milliliters per hour. Which nursing actions are appropriate? Select all that apply. A. Stop the magnesium sulfate infusion. B. Notify the healthcare provider immediately. C. Assess respiratory status and prepare for respiratory support if needed. D. Anticipate administration of calcium gluconate as the magnesium antidote. E. Continue the infusion because the client remains hypertensive. F. Monitor urine output closely. G. Recognize that impaired renal excretion can increase magnesium toxicity. Answer: A, B, C, D, F, G. Rationale: respiratory depression, absent reflexes, and oliguria are classic warning signs of magnesium toxicity. Magnesium is primarily eliminated by the kidneys, so reduced urine output increases toxicity risk. The infusion should be stopped, emergency assessment initiated, and calcium gluconate anticipated as the antidote. Question 36. A client with a history of gout begins allopurinol therapy. 2 weeks later, the client develops fever, facial swelling, diffuse blistering skin lesions, and painful oral ulcers. Which nursing actions or interpretations are appropriate? Select all that apply. A. Suspect a serious hypersensitivity or severe cutaneous reaction. B. Notify the healthcare provider immediately. C. Recognize that blistering and mucosal involvement require urgent evaluation. D. Tell the client to continue taking the medication until the next routine appointment. E. Assess airway status because facial swelling may threaten the airway. F. Recognize that serious reactions to allopurinol can be life-threatening. G. Document the reaction and ensure future healthcare providers are aware of it. Answer: A, B, C, E, F, G. Rationale: fever, facial edema, blistering, and mucosal lesions may indicate a severe cutaneous adverse reaction, including Stevens-Johnson syndrome, toxic epidermal necrolysis, or severe hypersensitivity. This requires immediate medical evaluation. Airway assessment is essential when facial swelling occurs. Nclex strategy: drug plus fever plus blistering plus mucosal lesions equals emergency. Question 37. A client with chronic pain has been taking acetaminophen-containing medication at home and is admitted with nausea, vomiting, right upper quadrant discomfort, and markedly elevated liver enzymes. The client initially reports taking only pain medicine, but medication reconciliation reveals several combination OTC products. Which nursing actions or interpretations are appropriate? Select all that apply. A. Assess the total daily acetaminophen exposure from all products. B. Recognize that unintentional overdose can occur with combination products. C. Notify the healthcare provider promptly. D. Anticipate serum acetaminophen testing when indicated. E. Recognize that acetaminophen toxicity can cause severe hepatic injury. F. Encourage the client to take additional acetaminophen for pain while awaiting evaluation. G. Anticipate administration of N-acetylcysteine when clinically indicated. Answer: A, B, C, D, E, G. Rationale: acetaminophen is present in numerous combination products, making unintentional cumulative overdose possible. Hepatotoxicity may occur after overdose, and N-acetylcysteine is the specific antidotal therapy when indicated. Nclex strategy: always calculate the total acetaminophen from every product, not just the patient's pain medication. Question 38. A client with hypertension is prescribed clonidine. The client reports that the medication makes the client sleepy and says, "Since my blood pressure is normal now, I stopped taking it yesterday." The current blood pressure is 198/112 mmHg, and the client reports severe headache and palpitations. Which nursing actions or interpretations are appropriate? Select all that apply. A. Recognize possible rebound hypertension after abrupt clonidine discontinuation. B. Notify the healthcare provider promptly. C. Assess for symptoms or complications of severe hypertension. D. Reinforce that clonidine should not be stopped abruptly without medical guidance. E. Encourage the client to take several extra doses immediately. F. Monitor blood pressure and heart rate closely. G. Anticipate a prescribed plan for safely restarting or adjusting therapy. Answer: A, B, C, D, F, G. Rationale: abrupt discontinuation of clonidine can produce rebound hypertension, sometimes severe. The client requires prompt assessment and provider management. Clonidine should generally be tapered rather than abruptly discontinued. Question 39. A client with type 1 diabetes mellitus is prescribed insulin glargine and insulin lispro. The client tells the nurse, "I mix both insulins in the same syringe, so I only have to give one injection." Which nursing responses are appropriate? Select all that apply. A. Explain that insulin glargine should not be mixed with other insulins in the same syringe. B. Reinforce the prescribed administration schedule for each insulin. C. Teach the client to verify insulin type and dose before administration. D. Explain that insulin lispro is a rapid-acting insulin. E. Encourage the client to mix glargine with lispro to reduce injections. F. Reinforce appropriate blood glucose monitoring. G. Assess the client's understanding of hypoglycemia symptoms and management. Answer: A, B, C, D, F, G. Rationale: insulin glargine should not be mixed with other insulin preparations in the same syringe. Lispro is rapid-acting, while glargine provides long-acting basal coverage. Correct timing, dose verification, glucose monitoring, and hypoglycemia education are essential. Question 40. A client with atrial fibrillation is prescribed diltiazem for ventricular rate control. The client is also receiving digoxin. During assessment, the nurse notes a heart rate of 48 per minute, blood pressure of 88/54 millimeter of mercury, and increasing dizziness. Which nursing actions or interpretations are appropriate? Select all that apply. A. Hold rate-slowing medications according to prescribed parameters. B. Notify the healthcare provider promptly. C. Assess the cardiac rhythm. D. Recognize that diltiazem can decrease heart rate and blood pressure. E. Recognize that concurrent rate-slowing medications can increase the risk of bradycardia. F. Administer additional diltiazem to achieve better rate control. G. Monitor for worsening hypotension and decreased perfusion. Answer: A, B, C, D, E, G. Rationale: diltiazem slows AV conduction and can lower blood pressure. Combined with other rate-slowing medications such as digoxin, it can increase the risk of clinically significant bradycardia and hypotension. The nurse should assess rhythm and perfusion and notify the provider. Question 41. A client with major depressive disorder has been taking an MAOI for several weeks. The client presents to the emergency department with a severe throbbing headache, palpitations, chest tightness, diaphoresis, and blood pressure of 224/118 millimeter of mercury. The client's spouse reports that the client recently attended a party and consumed several servings of aged cheese, cured meat, and fermented foods. Which nursing actions or interpretations are appropriate? Select all that apply. A. Recognize the possibility of an MAOI-associated hypertensive crisis. B. Notify the healthcare provider/emergency response team immediately. C. Monitor blood pressure and cardiovascular status closely. D. Assess for neurologic complications such as intracranial hemorrhage. E. Encourage the client to consume additional aged foods to lower the blood pressure. F. Review the client's recent food and medication intake. G. Recognize tyramine-containing foods as a potential precipitating factor. Answer: A, B, C, D, F, G. Rationale: severe hypertension, headache, diaphoresis, and palpitations after consuming high tyramine foods while taking an MAOI suggest a hypertensive crisis. This is an emergency requiring immediate assessment and treatment. Question 42. A client receiving enoxaparin after orthopedic surgery develops sudden shortness of breath, pleuritic chest pain, and hemoptysis. The client's oxygen saturation is 84%. The nurse is reviewing the client's anticoagulant therapy and laboratory results. Which nursing actions are appropriate? Select all that apply. A. Recognize possible pulmonary embolism. B. Assess airway, breathing, and oxygenation immediately. C. Notify the healthcare provider/emergency response team. D. Administer the next enoxaparin dose early to rapidly dissolve the clot. E. Prepare for diagnostic evaluation and additional treatment. F. Monitor for signs of hemodynamic instability. G. Recognize that anticoagulant therapy reduces thrombotic risk but does not eliminate it. Answer: A, B, C, E, F, G. Rationale: sudden dyspnea, pleuritic chest pain, hemoptysis, and hypoxemia are concerning for pulmonary embolism. ABCs and oxygenation take priority, followed by emergency evaluation and treatment. Anticoagulants prevent clot extension and new clot formation, but do not guarantee that thrombosis cannot occur. Question 43. A client with epilepsy is taking valproic acid. During a follow-up visit, the client reports persistent abdominal pain, nausea, vomiting, and unusual bruising. Laboratory results show elevated liver enzymes and thrombocytopenia. Which nursing actions or interpretations are appropriate? Select all that apply. A. Notify the healthcare provider promptly. B. Recognize that valproic acid can cause hepatotoxicity. C. Recognize that valproic acid can cause thrombocytopenia. D. Assess for additional manifestations of bleeding. E. Anticipate liver function and hematologic monitoring. F. Reassure the client that abdominal pain is always an expected harmless effect. G. Recognize that severe abdominal pain and vomiting may require evaluation for pancreatitis. Answer: A, B, C, D, E, G. Rationale: valproic acid can cause hepatotoxicity, thrombocytopenia, and pancreatitis. Abdominal pain and vomiting are especially concerning when significant or persistent. Liver function and platelet counts should be monitored, and bleeding should be assessed. Question 44. A client with severe bacterial infection is receiving gentamicin and reports new ringing in the ears and difficulty hearing. The serum creatinine has increased from 1.0 to 2.0 milligrams per deciliter. The nurse reviews the medication administration record and notes that the client is also receiving another potentially nephrotoxic medication. Which nursing actions are appropriate? Select all that apply. A. Notify the healthcare provider about the hearing changes. B. Notify the healthcare provider about the worsening renal function. C. Recognize possible gentamicin ototoxicity. D. Recognize possible gentamicin nephrotoxicity. E. Review concurrent medications for additive toxicity. F. Administer the next dose early to maintain antibacterial coverage. G. Anticipate reassessment of the dosing regimen and renal function. Answer: A, B, C, D, E, G. Rationale: gentamicin can cause both ototoxicity and nephrotoxicity. Rising creatinine and new auditory symptoms are significant. Concurrent nephrotoxic medications can increase renal injury, and dosing must be reassessed based on renal function and drug concentrations when indicated. Question 45. A client with heart failure is prescribed digoxin and furosemide. The client presents with nausea, vomiting, anorexia, visual disturbances, and a heart rate of 46 per minute. Laboratory results show potassium of 2.7 milliequivalent/L. Which nursing actions or interpretations are appropriate? Select all that apply. A. Suspect digoxin toxicity. B. Recognize hypokalemia as a risk factor for digoxin toxicity. C. Hold digoxin according to prescribed parameters and notify the provider. D. Assess the cardiac rhythm. E. Anticipate correction of the potassium abnormality as prescribed. F. Administer an additional dose of furosemide to remove excess fluid. G. Monitor for worsening dysrhythmias. Answer: A, B, C, D, E, G. Rationale: the client has multiple findings consistent with digoxin toxicity, including GI symptoms, visual disturbances, bradycardia, and severe hypokalemia. Furosemide can contribute to potassium loss, increasing susceptibility to digoxin toxicity. Cardiac monitoring and electrolyte correction are essential. Question 46. A client receiving 4-nitroglycerin for acute coronary syndrome suddenly reports severe headache and dizziness. Blood pressure decreases from 146/88 mmHg to 82/48 mm of mercury. The client is also taking sildenafil for erectile dysfunction. Which nursing actions or interpretations are appropriate? Select all that apply. A. Recognize that severe hypotension may be occurring. B. Notify the healthcare provider immediately. C. Recognize the dangerous interaction between nitrates and PDE5 inhibitors. D. Assess for decreased cerebral and coronary perfusion. E. Administer additional nitroglycerin to improve coronary blood flow. F. Review the timing of recent sildenafil use. G. Continue close blood pressure and cardiovascular monitoring. Answer: A, B, C, D, F, G. Rationale: nitrates can produce significant vasodilation and hypotension. Combining nitrates with PDE5 inhibitors such as sildenafil can cause profound, potentially life-threatening hypotension. Additional nitroglycerin should not be administered in this situation. Question 47. A client with a history of asthma is prescribed aspirin for cardiovascular prevention. Several hours after taking the medication, the client develops wheezing, chest tightness, nasal congestion, and difficulty breathing. Which nursing actions or interpretations are appropriate? Select all that apply. A. Assess airway and respiratory status immediately. B. Recognize that aspirin can trigger bronchospasm in susceptible clients. C. Notify the healthcare provider about the reaction. D. Assess the client's response to prescribed bronchodilator therapy. E. Tell the client to take another aspirin to determine whether symptoms are reproducible. F. Review the client's history of aspirin or NSAID reactions. G. Recognize that respiratory compromise takes priority over routine medication teaching. Answer: A, B, C, D, F, G. Rationale: aspirin and other NSAIDs can precipitate bronchospasm in susceptible individuals, particularly those with certain asthma phenotypes. Acute respiratory compromise requires immediate assessment and treatment. Re-exposure should not be attempted casually. Question 48. A client is prescribed lithium for bipolar disorder. During medication teaching, the nurse discusses factors that can alter lithium concentration. The client states, "When I'm feeling well, I usually go on strict diets and avoid salt. I also take ibuprofen frequently for headaches." Which teaching points are appropriate? Select all that apply. A. Maintain a consistent dietary sodium intake unless otherwise instructed. B. Maintain adequate fluid intake. C. Recognize that dehydration can increase lithium concentration. D. Ask the healthcare provider before regularly using NSAIDs, such as ibuprofen. E. Recognize that some NSAIDs can increase lithium levels. F. Stop lithium whenever sweating increases during exercise. G. Notify the healthcare provider about significant vomiting or diarrhea. Answer: A, B, C, D, E, G. Rationale: lithium levels are affected by fluid and sodium balance. Dehydration and sodium depletion can increase lithium reabsorption and toxicity risk. Several NSAIDs can increase lithium concentrations. Significant vomiting, diarrhea, or excessive fluid loss should be reported. Question 49. A client receiving chemotherapy is prescribed ondansetron for nausea. The client has a history of prolonged QT interval and is taking another medication known to prolong QT. The nurse reviews the client's ECG before administering the medication. Which nursing actions or interpretations are appropriate? Select all that apply. A. Recognize that ondansetron can prolong the QT interval. B. Review the client's current medications for additive QT prolonging effects. C. Notify the healthcare provider about significant QT prolongation. D. Monitor ECG findings when clinically indicated. E. Recognize that electrolyte abnormalities such as hypokalemia can increase dysrhythmia risk. F. Administer the medication without considering the ECG because ondansetron is an antiemetic. G. Monitor potassium and magnesium levels when clinically appropriate. Answer: A, B, C, D, E, G. Rationale: ondansetron can prolong the QT interval, and the risk may increase when combined with other QT prolonging medications or electrolyte abnormalities such as hypokalemia and hypomagnesemia. High-risk clients require appropriate ECG and electrolyte assessment. Question 50. A client with bipolar disorder is being discharged on lithium. During the final medication teaching session, the nurse asks the client to explain how lithium toxicity can be prevented. The client has recently started a job that involves working outdoors in very hot weather. Which client statements demonstrate correct understanding? Select all that apply. A. I should maintain adequate fluid intake, especially during hot weather. B. I should keep my dietary sodium intake reasonably consistent. C. I should report persistent vomiting or diarrhea. D. I should have lithium levels monitored as ordered. E. I can take NSAIDs regularly without discussing them with my provider. F. I should report symptoms such as worsening tremor, confusion, or difficulty walking. G. If I sweat heavily, I should stop drinking fluids so my lithium level does not become diluted. Answer: A, B, C, D, F. Rationale: lithium toxicity prevention requires adequate hydration, consistent sodium intake, appropriate serum level monitoring, and early recognition of toxicity. Heat exposure and heavy sweating can cause dehydration and increase lithium concentration. NSAIDs should be reviewed with the provider because some can increase lithium levels. How many did you get right? Review every missed question, especially the ones involving medication safety and toxicity, because those are the details that can make or break your NCLEX performance. Keep practicing, stay consistent, and trust your clinical reasoning.